We are a team of surgeons who run a group surgical practice whose focus is on liver transplantation and operations on the liver, pancreas, gallbladder and bile duct, gastrointestinal surgery in general, and hepatopancreatic surgery and cancers in particular. We get a significant number of referrals for pancreatic cancer. The pancreas is an organ located on the back side within our tummy. In fact, there's a saying that God placed the pancreas in the back to prevent surgeons from messing around with the pancreas. This saying was appropriate earlier in the earlier days because there were significant complications of surgery on the pancreas. The important message here is that pancreatic surgery should not be taken lightly. When a patient comes to us, typically with symptoms like loss of appetite, jaundice, yellowing of the eyes, dark colored urine, some loss of weight, and some of the patients have a discomfort in the upper right side of the tummy or the abdomen. This kind of symptoms in a relatively elderly patient makes us suspect that there is a possibility of some kind of tumor in the hepatopancreatobiliary area. And when we investigate, do certain investigations, we are able to arrive at a diagnosis. Now, with time, more and more patients are being diagnosed with pancreatic tumors. Not all of them have pancreatic cancer. Pancreatic tumors, pancreatic cysts, are different kinds of diseases. Pancreatic cysts have very good results. Some tumors of the pancreas, like neuroendocrine tumors, the results are much better than the more sinister or ominous disease that is pancreatic adenocarcinoma. The pancreas has a head, a body and a tail. So here you see the liver, the gallbladder, and from the gallbladder there's a bile duct which brings bile here. Inside the pancreas there is a pancreatic duct. The pancreatic duct and the bile duct meet and together drain into this little opening here inside the duodenum, which is a part of the small intestine. So this part of the duodenum where the pancreatic duct, the bile duct meet and the duodenum is closely sort of hugging the head of the pancreas. So this is a very vital and crucial part where many important structures meet. Tumors in this region, like the one here, can be quite problematic because it involves treatment of not just one organ but this entire area. When a patient walks into my clinic with symptoms suggestive of pancreatic tumors, the typical investigations we first look at are the blood tests, very important being the liver function test. Now here you see the interesting bit that we are talking about the pancreas, but one of the most important investigations would be the liver function test because the bile which comes from the liver drains through the pancreas. So we look at blood tests like the liver function test. We look at what is the level of hemoglobin and other important parameters, and we look at some pancreatic tumor markers which may give us some idea about the possibility of pancreatic tumors like adenocarcinoma. When we have the suspicion, we then advise a very good quality high-end imaging in the form of either a CT scan or a PET scan. Now we look at the CT scan or the PET scan and then we are able to diagnose with a high degree of certainty that yes, the patient may be having a tumor like this one. This would be among a bigger sized tumor of the head of the pancreas because even very small tumors in the head of the pancreas which are like 1 centimeter small they can cause significant problems, significant risk, including risk of spread to other organs. When we suspect pancreatic tumors, we are not so much bothered about the biopsy. Contrary to popular belief, a biopsy is not always necessary in treating or diagnosing patients with cancers, particular cancers like this one. But very important is the image on the CT scan or the PET scan. And if there is a tumor in this region which is causing jaundice, which is causing loss of appetite, which may be causing blockage of the bile duct, pancreatic duct, or may sometimes even be causing blockage to the passage of food, we suspect a pancreatic cancer, diagnose it on the basis of CT and PET scan, and then we have to do the very important thing of discussing and educating the patient and the family about the disease. And then we ensure that if the patient has a relatively early stage disease, then the treatment would be in one form, and if it's a relatively advanced stage disease, then the treatment would be quite different.